Breaking news here in Washington, D.C. about President Joe Biden. He tested positive for COVID-19 today. And earlier today during a White House press briefing, Dr. Ashish Jha, he's the White House COVID coordinator, said the Biden administration is following all the protocols to protect the president and those around him.
We've had a protocol that I think has done a very good job protecting the president. The most important part of that protocol, by the way, is making sure that he was up to date on his vaccines and we had access to treatments. The president wants to get out there and be with and meet American people and engage. And we always said that this was a possibility. The good news is his immune system is very well protected given the 4 vaccine shots he's gotten. He's getting treatment. He has mild symptoms. He's feeling fine.
So for more, let's bring in ABC News' Kenneth Moton and Dr. Brownstein. Kenneth, White House says they're following all the protocols. So what exactly does that mean? What are they doing?
It means regular testing, Terry, as well as contact tracing. For the president, it means isolation for at least 5 days, which he can end. After that, if he's fever-free and testing negative, there will be a limited footprint inside the residence where the president is isolating. The press secretary says the goal is to keep others safe. We're told no changes to staffing protocols. In the West Wing, the White House chief of staff just told us that they don't know how the president was exposed to COVID-19 or how he was infected, but they do say that so far there are no positive cases that are linked to the president.
All right. Kenneth, today's press briefing, they went around and around and around, the reporters asking lots of questions that centered on how the White House is handling it. That's their job. So how transparent is the White House being? What are we learning about that?
Well, they're trying because, Terry, we know that when it comes to the president's health, bad health, and God forbid, the death of a president in office can have a profound impact on the world. It can move markets. It could cause the defense of the homeland to be on even higher alert. It can raise the eyebrows of our enemies here. And when it comes to the transparency of this White House compared to the Trump White House, we saw a lack of transparency in the Trump White House when he got COVID. And so we know it's incumbent on the Biden White House to give as much information as possible. That's why we saw what we saw today, Terry. It's why we saw the president in video. It's why we saw, those officials there in the press briefing room giving information about the president's runny nose, his fatigue, his dry cough. We were told about the president's activities so far today, working from the residence, calls with the senior staff, calls with members of Congress, calls with officials where he was supposed to meet with them today in Pennsylvania, but obviously had to cancel. And so that's why we saw the coordinator of the COVID-19 response, Dr. Ashish Jha, saying the president sounded great, that he was examined by his personal doctor. The press corps wanted to hear from the president's personal doctor, but we understand he will be giving daily statements about the president's condition.
And that is a break with tradition. Presidents, when they get ill or have medical procedure done, it's usually their personal physician or the physician who is performing the procedure that will brief the press. This is a little different this time. Dr. John Brownstein, who's Chief Innovation Officer at Boston Children's Health. Let me go to you on the question. As soon as people heard it, everyone had the same thought. Joe Biden, God bless him, is old. He's 79 years old. How do you assess how do you answer the question, should we be worried?
Yeah. Well, listen, I think any infection is concerning, Terry, but the good news is the symptoms have been mild so far. Runny nose, dry cough, oxygen levels are good. He feels relatively good. We're at a different place than the last time a POTUS got COVID. Biden is fully vaxxed, double boosted on a therapeutic. Breakthrough infections happen, but they're usually well tolerated when you're fully vaxxed and boosted. And yes, he had his last booster March 30th. So it's clear that this BA.5 variant is spreading fast and it's causing breakthrough infections. But we know that if you're fully up to date with your vaccines, you're 14 times less risk of death is there because, in that age group of 65 and over. And he doesn't have any underlying conditions that would significantly impact his immune system. He is in the older age group of 79. So definitely there's a concern, but he's getting the best possible treatment, has access to top medical care, and has access to therapeutics, including Paxlovid, which all of us have access to. So the overall concern is pretty low at this point.
And as you mentioned, he's double vaxxed, double boosted, and as somebody who's had had COVID twice, the sense of relief when you have been vaccinated, the sense of safety around it. Yes, people can get very sick nevertheless, but I wonder if this is almost a teaching moment for the public should things proceed well as we expect them to on the subject of vaccinations. What do you think, Doctor?
I think it's a really good point, Terry. And I think actually Dr. Jean made it that point earlier. It is a testament to the vaccines that are working. Yes, we know you can get breakthrough infections, but those breakthrough infections are less severe and the risk of dying is so much lower. And what the president is getting in terms of vaccines and therapeutics is what's really available to the broad public right now. There is so much supply of vaccines and therapeutics. So he's not getting anything different than anyone else who got an infection. I'm fully vaccinated. I got Paxlovid when I was sick. You can get it. So it's really an example of the amount of work that it's taken to get this pandemic under control. And the president is a really good example of that right now.
Let's hope people take it up because the shots work for sure. Kenneth, the press secretary, Karine Jean-Pierre, she was asked to compare the Biden administration's response to that of former President Donald Trump. From your point of view, reporting on these administrations, how do they differ?
Well, we saw the transparency difference already when it came to the lack of transparency in the Trump White House versus all of the information that we got today from the Biden White House. But we should also point out the protocols that are different from the Trump White House versus the Biden White House. We were in the heat of COVID-19 pandemic. We're still in the pandemic, but we were really in it because we didn't have a vaccine when the former president was diagnosed and tested positive. And at that time, we saw the really the flaunting of mask rules and protocols that we didn't see that much of in that Trump White House. And then I actually reported right here on ABC News Live when the administration changed that there was going to be not only a deep cleaning but a change in mask protocols and testing, and we see regular testing inside the Biden White House, and we saw masks being mandatory for some time before things started to change. And not only because we had the vaccines, but people were going back into work, back into the office, and we started to see some of those protocols get a little bit more lax. Different times, same virus. Kenneth and Dr. John Brownstein, thanks very much for that.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.